Why do I do that to myself? Why do I keep stopping myself so that way I can restart? I don't know. I gotta get comfortable. Okay. All right, am I comfortable? I think I'm comfortable. Are you comfortable? I hope you're comfortable. Hi guys, how are you? I hope you're doing okay. I know it's been a little bit of time since I made a video, my first video, but this is my second one. I kind of wanted to talk about what I did today. It's kind of a big deal, I mean, for me, and for a lot of people, right? Today I went for a consult for bariatric surgery. Okay, so you're like, what is bariatric surgery? Brittany, what is this and why are you doing it? Well, I have quite a few reasons why I need to do it. And if you haven't seen my video about ribelsis and my journey with ribelsis, essentially, I have been trying to lose weight for a long time, years at this point, and nothing has actually made the progress that I would like to have. I exercise a lot. I eat healthy. I don't go out to eat. I don't eat fast food. I don't drink anything that has calories. I only drink water. I've been very, what's the word I'm looking for? I've been good. I talked to a dietitian today and I've been doing pretty well, but it's not working. So what do you do now? Like, what's the next step after trying to lose weight for years and it doesn't work? Well, this is an option that can be done. Bariatric surgery is essentially a tool that can help you to progress along weight loss. So is bariatric surgery a weight loss surgery? Yeah, it can be if you follow the guidelines and do things the right way after having it done. It can really help you, and it can do awesome things to help you lose weight. I personally have seen it work for someone in my family and for someone that I know, and it worked for them and they've been doing well, and that's awesome, and it's kind of inspired me to go down this path after all of this time. Also, you guys, I'm sorry about my dogs. If they run in and out and they're barking, sorry about that. See, there's one. That's Valentine. Hi, Valentine. He'll be around. So, my medical insurance through my husband's work does cover bariatric surgery, and I am so lucky and blessed that it does, because there is a hospital not that far from me that actually does it. This hospital does 2 types of bariatric surgery. There are a few, but these guys specialize in gastric sleeve and the gastric bypass, which is probably the most popular, or these 2 are the most common that you're gonna find. So a sleeve gastrectomy is when they essentially turn your stomach, they take a big part of it out and then they turn it into like a sleeve. It looks like a tube. They don't put a sleeve on it. They cut that part of your stomach out. I'll put a picture up here for you guys. And then gastric bypass essentially is kind of similar, where they reroute the food to your intestine and then they leave your stomach in there, and because it creates enzymes and stuff that your body needs to process, it helps you process food, and they kind of reroute it a little bit. But either way, they're both they both work and they're both safe, and they're both usually pretty successful. The surgeon that I spoke with today said that the bypass is a little bit more successful than the sleeve, although they both are. But me personally, I am a candidate for the bypass because I have acid reflux, and if you get a sleeve like the gastric sleeve, it can make your acid reflux way worse. While if you get the bypass, it can actually make it go away almost entirely. You might not have to take the medicine anymore afterwards, which would be amazing, because I would love to not have another medication that I would have to take. But yeah, so essentially today I met with the surgeon. We had a good talk. We talked about I got this awesome patient book that's got all kinds of stuff in it, and we talked about the different surgeries, what they do, the success rate, the risk factors, the things that can happen after, all of the possible complications. We talked about them, and what they do to prevent that. How he told me about one of the main issues that usually comes up is people being dehydrated, and that is something that I can work towards not doing by always having water with me and things like that. So yeah, we did a whole conversation. It was really nice. And then I actually met with a dietitian, and we talked about a meal plan, because before you can have bariatric surgery, you do have to lose a little bit of weight. It's not much. It's only like 7%. So 7% for me is only it's like 16 pounds, which I can do. I don't actually have to have a program before I can have the surgery, but I do have to go through some steps before I can get there. So they want me to do a sleep study, which should be interesting. I've never done anything like that before. So they're gonna do a sleep study to make sure I don't have sleep apnea. And then we're going to do an endoscopy. So they're gonna go in and check my stomach and make sure there's no, he said make sure there's no surprises in there, which makes sense totally. And then an EKG to check my heart and make sure I'm good, which I had a hysterectomy 2 years ago, so I know all that stuff's gonna go fine. I've already done all of this once before, but I will do it again, you know? So after I talked about all of that, and then we got my meal plan set up, which is I really only have to do it for like a month or 2 months, but it's like a 1,200 calorie or less meal plan. Kind of sucks, but it'll be all right. I can handle it. I know a lot of people typically can have more, but because of my height, I'm really short, and just the weight that I need to lose before surgery, I have to stick to that for a little while, and that's okay. But anyway, after we talked about all of those things, the doctor showed me a paper. Let me see if I have it. And it was the projection of weight loss that I could get after having surgery. And it was 75.19 pounds a year out. So if I stick to the plan, I follow the rules, I stick up with my exercise, I follow the diet rules, it's possible that I could lose 75 pounds, and that would be life-changing for me. That would change so much, because I am at risk on like pre-diabetes and blood pressure and stuff like that, and that's stuff that I really do want to get better. Like it's something that I really want to work on, and I've been trying to work on for a long time, getting my body healthy and being better and doing better, you know. There was a little bit of a time where I lost some weight, but it wasn't sustainable. Like it wasn't healthy the way that I did it, and it just came right back. So I want to do this the right way, and I want to go through it the right way, and they think that I'm a good candidate for this surgery. I know that surgery is not like a big thing for everyone. It's not something that everybody wants to do or have done or even recommends, but me personally, it's something that I do want to do. I do want to do this. I want to do it right. I want to follow all of the rules, and I want to have success, and I think I can do it. I really do. It's all a very vulnerable thing for me. Like, it's hard to talk about, but I'm at the point where I'm gonna be 34 next month, and I don't really care anymore. Like, I think that if I could share this with you, not only will it help me be accountable, but if someone is out there that can relate to me, and or if you just want to hang out with me and be supportive, that would be so cool. That's all that matters to me anymore, you know? Like, if I can relate to someone else, or I don't know, just be there, it would mean the world. And yeah, I want to get healthier. I want to live a long, healthy life and see so many things, and this is it's a start. I feel like I've been on this journey for a really long time. Like, I had diabetes when I was pregnant with my daughter, and that was 12 years ago. And after that, my body just did not agree with me. It's been a battle for a long time, and I'm ready to to get past that. And it's like, it's not for superficial reasons, it's because I want to be healthy. You know, I know a lot of people will go into stuff like this because they care about being skinny and attractive and whatever. Like, I don't care about any of that. Like, I could care less what someone thinks that I look like. I really could. I just really want to get better and be healthy. And that's it. So if this can get me where I need to go, I'm ready. I'm here for it. And I know it's going to be a ride. I know it's going to be a journey. But if you want to hang out with me while I do that and be here with me, that would be awesome. That would be so cool. Keep me accountable, right? But anyway, yeah. I think I can handle it. I think we can do it. I think I have an awesome support system. And to all you guys, my family, who have been there with me, and friends, I love you guys so much. You guys don't understand how awesome and amazing and motivational you are to me. And I'm excited for the future. So let's do it. Let's get it. Let's get it done. Let's do the thing. Anyway, that's gonna be it for me, you guys. Thank you so much for hanging out with me. And if you're, you know, gonna follow me on this path and journey adventure, thank you. I love you. And yeah, I'll see you guys next time.